get started. So I'll have Dr. Butt and Tracy Muggli introduce themselves and their positions, a few opening remarks, and then we'll go into question and answer.
Okay. Hi, I'm Tracy Muggli, TRACY-MUGGLI, Director of Mental Health and Addiction Services.
And I'm Dr. Peter Butt, surname B-U-T-T. I work as a consultant in addiction medicine to the Saskatchewan Health Authority, and I'm also on faculty with the College of Medicine at the university.
So thanks everyone for coming today. We wanted to give you the opportunity to ask us questions in light of the opioid overdoses that took place on the weekend. We want to make sure that we can provide you with information so that the public knows how to get the help they may need if they're experiencing an opioid overdose. So I'll just put it out to you to ask questions.
We've heard a lot in recent years about fentanyl overdoses in the city and the province in Western Canada. How unusual or not was it to have a rash like this and to have had the drug cut with cocaine?
Well, all of that is not at all uncommon to have peaks and troughs, just as people have experienced that with heroin historically in Vancouver, for instance, when you get a more potent supply in that hasn't been cut as much. Increased potency results in increased toxicity and more overdoses. It's the same with fentanyl. So there are times when you will see a cluster if it's more potent than what people are used to. Or if it's a circumstance socially where there are more naive people trying it at the same time together, and because they don't have any tolerance, they may overdose and experience a poisoning. So it's not surprising, first of all, to see these kinds of clusters periodically, which is why within the drug-using community in Vancouver, because of their experience with heroin, they encourage people to test dose, to test the potency before they take a larger amount, or what they would consider to be a normal amount, to ensure that it's not stronger than what they have tolerance for. With regards to the second question, it's not at all uncommon in the urine drug screens that I see to see cocaine combined with sometimes methamphetamine or fentanyl. With regards to fentanyl, sometimes it's sold that way as a so-called speedball, a combination of opioid and stimulant as a product. At other times, though, it may be put in there surreptitiously to get the clientele, the customers, dependent on the opioid, so they come back on a more regular basis for supply.
And is there anything that the health authority is doing in particular in light of the fact that there could be more people in the city who have in their possession this potentially lethal drug?
We certainly have naloxone kits that we can provide to the public. We have a model of one here. We do have a clinic twice a week where people can come and learn how to use the kits. And we also work closely with Mayfair Pharmacy, who also provides kits. So our naloxone program, we believe it's important that people consider having a naloxone kit with them if they or a loved one are using opioids or whatever they might be using and not be aware of what's in the product that they may consume. They should have naloxone kits, and we're happy to be able to work with them to provide that.
And the police spoke a lot today about amnesty. If people are coming in with this drug, they're not going to be charged. What about people coming in for naloxone kits? Is that something they could be concerned about?
I certainly would hope not. We would, any healthcare service that we provide to people is confidential, and of course privacy is at the utmost importance. To our interest is to make sure people get the help they need and to prevent tragedy.
Mm-hmm. And are the kits free of charge for people who need them?
When people are using opioids, they can be provided with a kit at no charge. There's also a number of people who have coverage, and we support them to make sure that we work with the pharmacy to get their coverage so that they can have a free kit as well.
But at the same time, I think it's important for people to realize that they can receive training if they're a parent or an associate of a user in some way, a partner of a user. If they're in the household where there may be people using, they can still receive training and get a kit, but the cost is, what, $30 to $40, I think. It's not covered by the province.
The naloxone kits, they're one dose, right?
No, in each kit, typically there's a container, and within that there would be 2 vials of naloxone, so 2 single-dose vials. So people can draw up one and administer it. If there isn't an adequate response within 5 minutes, they can give another dose.
without a naloxone kit, is there anything that you can do to help someone who's experiencing an overdose?
Absolutely, and in the kits themselves, they're well designed. People are instructed to call 911 first of all, and then to check their airway, see if they're breathing, to ventilate if they're not, to give compressions if they feel comfortable doing that, but then to administer the naloxone in the situation that they think is a drug overdose. There are many situations where there'll be more than opioids involved, but they don't have to worry. This is not going to cause harm, and it may still save a life if it's a drug mixture of some sort.
And more proactively, if people are using opioids or are using any substances, they can access our services for addiction counselors by calling 306-655-7777. We also have our brief and social detox that people can access. We also have a methadone program that people can access. So there are services available for people that want to get support to address addiction.
And I think I saw online that transportation was being offered to the Mayfair Clinic if people wanted to get the naloxone kits but didn't necessarily have the means to get there. Can you speak to that at all?
I believe that was a post by Aid Saskatoon,
Yes,
so
correct.
I'm not familiar with what they've offered.
I think they're offering it as a public service.
Yeah.
And indeed, everything that we're trying to do within the health region is consistent with the provincial strategy. So there are prevention initiatives such as the public education that the media is doing, as well as harm reduction initiatives such as the take-home naloxone, treatment by connecting people with care through addiction counselors and opioid agonist therapy, methadone or Suboxone, whatever is indicated, as well as, of course, working with law enforcement. They have their work to do, and I think they should be commended for the rapid response and the public service announcement that they put out over the weekend.
What are some signs that people should look for of someone having an overdose?
Well, when somebody is having an opioid overdose, what happens is it reduces the breathing, the respirations. So the breathing will become more shallow, it might become obstructed in some way, they'll begin to turn blue around the lips and in the nail beds and the fingers. They may stop breathing altogether. They're hard to rouse. They seem like they're just drifting off, but if they can't be roused and they're turning blue, then immediately one should respond. And the sooner the better. The other challenge, of course, is that although the naloxone may begin to work within 5 minutes, it may stop working after 20 to 30 minutes. And during that period of time, the opioid poisoning may continue. So this is a problem for when people don't call 911 and get more definitive care, the overdose may come back. Or they're woken up with the naloxone, they're immediately in opioid withdrawal, and naturally the way for them to treat that is to take more drug. So it can exacerbate the overdose, and you can get a series of overdoses or poisonings that way. It may seem irrational to a lot of people, but when you think about it in the context of going in and out of acute withdrawal, it has some logic behind it. Any other questions?
Well,
That's
really
everything.
appreciate you coming and encourage you to share this information, because we want to make sure people get the help they need and that people can get their hands on naloxone kits if they're concerned about opioid overdose. So we really appreciate it.
Great,
Thank
thank
you
you so
very
much,
much.
guys.